This is how to pass your Med Surg Hesi. Meet us here every Monday to practice 10 questions and view rationale. A client with heart failure is prescribed furosemide. The nurse should monitor the client for which potential adverse effect of this medication: hyperkalemia, hyponatremia, hypokalemia, or hypernatremia. The correct answer is C. Furosemide is a loop diuretic that can lead to the loss of potassium, resulting in hypokalemia. Monitoring potassium levels is crucial to prevent complications such as cardiac dysrhythmias. The nurse is caring for a client with chronic obstructive pulmonary disease. Which assessment finding indicates the need for oxygen therapy? Respiratory rate of 18 breaths per minute, pulse oximetry reading of 95%, blood pressure of 120 over 80, or cyanosis of the lips and fingertips. The correct answer is D. Cyanosis indicates inadequate oxygenation. Oxygen therapy may be necessary to improve oxygen saturation and relieve hypoxia. A postoperative client has decreased bowel sounds and reports abdominal distension. The nurse should suspect which complication: constipation, paralytic ileus, gastroenteritis, or appendicitis. The correct answer is B. Postoperative paralytic ileus is characterized by decreased bowel sounds and abdominal distension. It results from temporary cessation of bowel peristalsis after surgery. A client with diabetes mellitus is admitted with hyperglycemia. The nurse understands that which hormone is responsible for lowering blood glucose levels: insulin, glucagon, cortisol, or epinephrine. The correct answer is A. Insulin is responsible for lowering blood glucose levels by facilitating the uptake of glucose into cells. In diabetes mellitus, there is insufficient insulin production or ineffective use of insulin. A client with a history of hypertension is prescribed an ACE inhibitor. The nurse should monitor the client for which potential side effect of this medication: hyperkalemia, hypoglycemia, hyponatremia, or hypercalcemia. The correct answer is A. ACE inhibitors can lead to an increase in potassium levels. Monitoring electrolyte levels is essential, especially potassium, to prevent complications. A client with rheumatoid arthritis is prescribed methotrexate. What should the nurse instruct the client to do while taking this medication? Avoid sunlight exposure, increase dietary intake of vitamin K, limit fluid intake, or report signs of infection promptly. The correct answer is D. Methotrexate is an immunosuppressant, and clients taking it should be educated to report any signs of infection promptly due to the increased risk of immunosuppression. A client with chronic kidney disease is prescribed a phosphate binder. Which statement by the client indicates an understanding of the medication's purpose? This will help lower my blood pressure. I will have fewer episodes of acid reflux. It will prevent calcium from building up in my arteries, or this will control the levels of phosphorus in my blood. The correct answer is D. Phosphate binders are prescribed to control hyperphosphatemia in clients with chronic kidney disease by binding to dietary phosphorus, preventing its absorption. A client with pneumonia is experiencing increased respiratory rate, dyspnea, and chest pain. The nurse should suspect which complication: atelectasis, pleurisy, pulmonary embolism, or pneumothorax. The correct answer is C. Symptoms such as increased respiratory rate, dyspnea, and chest pain may indicate a pulmonary embolism, which is a serious complication of pneumonia. A client is receiving heparin therapy for deep vein thrombosis. The nurse should monitor which laboratory value to assess the effectiveness of the medication: PT, APTT, INR, or platelet count. The correct answer is B. Heparin's therapeutic effect is monitored by assessing the APTT. It measures the time it takes for blood to clot and helps ensure that the client is within the desired therapeutic range. A client with cirrhosis is at risk for developing hepatic encephalopathy. Which dietary instruction should a nurse provide to the client? Increase protein intake, limit sodium intake, avoid foods high in potassium, or restrict dietary protein. The correct answer is D. In clients with cirrhosis at risk for hepatic encephalopathy, dietary protein may be restricted to prevent the accumulation of ammonia, a byproduct of protein metabolism, which can exacerbate encephalopathy. Click subscribe and join us next Monday for Med Surg Monday.